So people can have scoliosis at any age, and certainly there are adults that had scoliosis that has been there since they were a child. Certain adults can develop scoliosis, but the vast majority of people who develop scoliosis get it when they're very young. And in reality, you can have scoliosis from the age of birth all the way through your teenage years. The vast majority of patients that we take care of do get scoliosis right around the time of their growth spurt. So it's really important in children who have scoliosis to monitor them and understand when they're going through the growth spurt, when they're growing the fastest, because we have to understand when is their greatest risk of progression, and being able to be proactive in treating it, especially when they're going through that growth spurt and or we see change in the curve. So the goal of treating scoliosis is to keep the curve as small as possible so that when you finish growing that it does not get worse as an adult. So if you have a small curve, let's say under 20 degrees and you're still growing, we often still watch that. As the curve gets more to an intermediate size curve, we sometimes will actually treat that to try to prevent it from getting bigger. But if we can finish growing with a curve smaller than a certain size, and that size is 50 degrees in our chest area or about 45 degrees in our waist area, then the thought is that that curve does not get worse as an adult. So the whole goal of treating children with scoliosis is keeping the curve as small as possible so that it's not progressive as an adult. If the curve reaches that size where we're worried it's going to be progressive as an adult, we then often decide to treat the children so that they don't have problems later in adulthood.